Hello, everyone. Welcome to ThinkTech's virtual meetups for the summer season, an initiative organized by the Saudi Ministry of Communications and Information Technology. ThinkTech aims to create a stimulating digital environment and to spread digital awareness about emerging technologies. In this optic, we are happy to introduce you to a series of meetups focused on emerging technologies. Today, we have the session AI for COVID-19 and the days after. Your moderator is Ahmed Bouhamsine, co-founder and CEO of Quant Data and Analysts. Ahmed leads a team of data scientists and actuarial analysts in exploring data. Prior to co-founding Quant, Ahmed led the R&D department at Lux Actuaries and Consultants, improving products and services for their customers by using advanced analytics and big data tools. He previously worked as an actuarial analyst focusing on pricing and reserving for insurance companies and groups in the GCC market. Ahmed, the floor is yours.
Thank you, Jana, for the introduction, and hello, everyone. Today, we have an amazing session with three of international consultancy. I would like to give them the floor to introduce themselves in the beginning before we jump in with our interesting, challenging topic, how AI could help us during the epidemic for COVID-19. And we'll start with you, Timur. You're muted, Timur.
It's always the mistake we make, right?
No worries.
Thank you, Ahmed. Thank you, Jana, and everyone behind ThinkTech for organizing this and inviting me. Great pleasure to be here, and for everyone taking time to attend. My name is Timur Koshlo. I'm a partner in PwC Middle East. I look after the team of responsible advanced analytics across the region. We have a team of around 20-25 people. We work closely with our industry experts and advisors across different competencies. We help them predominantly leverage data better to give better advice to our clients. For a good part of my career, I was focused on, my focus was on the forensic technology and forensic data analytics. Some time in the UK. So that's leveraging data and looking into answering the questions of regulators and investigators, whether it's criminal investigations or civil investigations, dealing with variety of data from call logs, building access logs to emails, financial records, etc. Looking forward to this discussion and sharing some of the examples of work we've done since the COVID pandemic hit.
Jamil. Also here we have Abdo Ayoub.
Thank you, Ahmed. Thank you for the invitation. It's a pleasure to be here. I'm the managing director of Paragon Shift. We work with our clients primarily to help them understand the value of their data, and especially when we're working with solutions around analytics and AI. When the COVID pandemic hit, there was so much that could be done in a short period of time, and we were trying to understand how we can get that value relatively quickly. So I'm looking forward to sharing some of those use cases that we've done with you, both with the team that's in the Middle East, as well as with the team that's in Toronto, where I am right now, and in Cleveland in the US.
Great. And finally, we have Jim Musa.
Hello, everybody. My name is Jean Musa.
Jean Musa, sorry.
I know the name is not easy. So I'm the managing partner of NetWays. NetWays, we have 10 branches in 7 countries in the region. And we are mainly specialized in the government and in financial sector. And during this pandemic, we were like, suddenly we found ourselves, each one in a country that we cannot move, and while we have lots of experience in handling the situation, and we are mainly specialized in digital transformation. So our main target and business was to transform the way companies work. And the pandemic, even with all the bad sides of it, it changed the culture. It changed the way companies and enterprises, they think about technology. because they used to take it as a let's say luxury or good to have, and suddenly it's a must to have. And people, they used to come to their offices, they use technology as part of their business. Suddenly we found that the technology was everything. So if you don't use technology, you cannot work, you cannot operate. So in this situation, we transformed all our capacity and resources toward helping enterprises to react to the situation, to the sudden situation. And this is what I'll be talking about if you want.
Jamil, Jamil. Thank you all for this amazing introduction. And let's jump into the question. At first, we know that AI is being utilized in healthcare as a researching tool to support the decision maker. Here, after COVID-19 started, the challenges started to become mostly different, and for every industry, they have their own challenges. I would like to hear from you how AI was utilized by your organization to support internal use cases or to support your client with their challenges. Can we start with you, Timur?
Of course, thanks, Ahmed. I mean, it was scary and quite unpredictable start of the crisis. I mean, we saw it coming, but it hit by a surprise still how fast things evolved over the course of a week. As consultants, we spend our life in a suitcase traveling from one client to another. And for first time in almost a decade, I managed to stay in one place for 3 weeks. It was really weird time. So I think initially, while things were evolving quite quickly, I mean, nature of our work, we deal a lot with government agencies, decision makers, etc. And of course, the first habit in such situations is reaching out, say, how can we help? So initially, it was around the contact tracing, which was seen as one of the key tools to fight the spread and tackle it. So back in March, there was hardly any applications for contact tracing. I think probably to this day, the adoption of it is not to a level that makes it the silver bullet or close to it even. So initially, understanding what the authorities and the crisis management units are doing, and reaching out and basically looking for areas we can help. So initially, we basically developed a prototype as a proof of concept where we suggested that authorities use mobile traffic data for identified patients instead of just heavily relying on interviews to capture where the patients have been in the 2 weeks prior to the diagnosis. I know this sounds intrusive, but quite a lot of patients were more than happy to provide that data because it was heavily reliant on memory, who they've met, where they've been in the 2 weeks. If you come across someone like me, I mean, I can hardly remember where I was yesterday or struggle with this morning. So I have an example of that prototype to hand. I've picked it up this morning, but basically what we've done there is spoke to the telecom companies, understand what data is available historically, and basically got volunteers from our team and myself to volunteer with sharing the data from our own mobile devices, and basically build a prototype that helps identify hotspots of risk areas where patients have been in the period of the 2 weeks period up to diagnosis, and also identifying overlapping areas where 2 patients or more have been in one place at the same time to help basically have more surgical approach to where quarantines and lockdowns can be done, but also the more proactive measures in terms of sanitization and targeted testing can be done as well. And the other side where we got involved as well at the very start was basically scenario planning and capacity management, understanding where the hospitals, the quarantine centers, the ICUs equipped to deal with these cases are across the country, and using geospatial analytics and relying on the likes of TomTom and other providers for geospatial data and traffic information, to see basically within a 30 minutes drive from any location or significant population areas, that you make sure you have the right ER and ICU units who can deal with these cases. Still early days. I think there's not much of ventilators around, so we didn't know much of that on that front or detailed planning, but it was mainly on that high level planning and decision making support mainly.
Jamil. And using the telecommunication data sources was targeted to try to identify the location for the patient and who else was in contact with, then sending alert or messaging to these contacts so they can go for testing.
So telecom data is very hard to get hold of. I mean, understandably, the data privacy elements, etc. So we had to work around it, and we really didn't want to get our hands on patient data or personal identifiers. Hence, we've opted for leveraging what we know about what's available at telecom companies and working with a couple of telecom companies to understand and validate some of the assumptions we made. Now, whenever you use your mobile, whether it's text message data or receive a call or send a call, you are connected to a telecom tower.
Right.
And in the intercity, in a highly densely populated areas, those mobile towers cover, on average, I'd say a distance of 250 meters, more or less. I'm not a telecom expert, so my numbers might be out by a mile or so. But luckily, we have some good telecom experts in the team. So understanding which towers that users were connected to allows you to kind of like build a history of where a person has been. It's not an exact science because you have to use your phone to be able to leave a footprint. And also different telecom companies leave that data on their systems for a short period of time, given the data volumes it creates. The other shortfall of that data, and in a way also I look at it in a positive way as well, is it's not exact location. So triangulation of where a person has been can be done if someone is holding 2-3 mobile devices, right? Because it allows you to see the overlapping areas between multiple different towers. But it's working from transactional log data that is sitting unutilized or not used for very good reasons at telecom operators for a good cause. Now, there are better alternatives, but once you get a more accurate estimates of where people are or where people have been, this is where you kind of like, it's a bit invasive in terms of privacy and can identify individuals. So some of the towers which are on the outskirts or more rural areas can cover kilometers of distance. So that's not so impactful or effective in these areas. But nevertheless, it helps to say like this region or this city, no one's been diagnosed none of the people that have been diagnosed has been to that city, right? So a quarantine measure or lockdown measure might be just lock it down, but leave it as business as usual as you can, because basically you can get away with it. So trying to make the best out of information available. I hope that answers your question, Ahmed.
Yes, clear. And great use case, utilizing this data as a short time. I understand in the beginning of the epidemic, lots of organization and international company like Google and Apple, there were talks and announcing for a new data procedure that they would provide for government so they can utilize this in their application for close contact, but not using GIS data. However, they use, I think, Bluetooth technology where they could identify a close contact between multiple mobile. And here in Saudi Arabia, they are utilizing this technology under the application Tabaud. It's been published by Sadia and Ministry of Health recently. I did not use the app yet. I will use it, and trying to be safe more and more. Great. Abdu, also you told me that you were working on a couple of use cases on bid management and supply chain management for healthcare organization. Right. Can you give us more insights on these use cases?
Sure. So the first step, the biggest concern that was available up front was being able to understand what's going on and being able to visualize what was happening. And so the first challenge was to understand what the capacity.
You're muted, Abdu.
Sorry. To understand what the capacities were within specific facilities and what was available and what was being consumed. So stage one was capturing the data and visualizing it to be able to understand what was there. From there, we moved on to helping the facilities do a little bit more of planning. And the way we did that was by being able to predict what the length of stay of a specific patient was going to be. The hospital can see 3, 4, or 5 days into the future what their potential capacity was going to be. And accordingly, they could plan much better. They could triage their patients very differently to understand, is this the type of patient that has symptoms where they're going to be staying 2 to 3 nights, or is this the type of patient that's going to be here for the next 4 weeks? And being able to do that early on allowed them to prioritize patients much better and be able to provide much better care. So that's with regards to the bed management aspect. The other challenge was the availability of equipment and PPE and medication on the floors, not just for the COVID patients, but more for other patients, because when these hospitals went into panic mode because of the influx of the patients that were coming in, they wanted to make sure that even the non-COVID patients were still getting the same level of care and not marginalized, so to speak. And the intent of the assistive technology was to help them plan better with what type of inventory was needed, what equipment, what medication was needed at the level of the cart with the nurse right next to the patient. And that model helped plan from the warehouse of the hospital to the floor, from the floor to the specific cart, based on which patients that specific cart was treating and what's the likelihood of what medications are they going to be needing to make sure that it is as close as possible to the patients when they needed it. So those are two of the big scenarios that were done. The third one was around procedure and protocol for sanitization within the health environment. And so when a certain number of individuals walked into a room, by procedure, they were expected that they were going to sanitize their hands with the dispensers. And so these dispensers were converted using the IoT technology into smart devices, so that we can count how many people are going into a room, how many people are moving out of the room, and then how many different squeezes were taking place. So you could sort of do a checks and balances to make sure that that device was being or dispensing enough relative to the number of people that walked in or out of a room.
Great. I'm sure this effort and initiative taken by you and your team saved lots of lives and impacted them directly. Since, as you mentioned, in the beginning of the pandemic, lots of hospitals are new for these challenges, and definitely technologies needed to be supported during this time of epidemic. Okay, I will ask you a question mostly for the tech geeky community and think tank. Usually when you are building a model, for example, as you mentioned, for length of stay for a patient, since the patient are very little and the virus just started to spread, what is the data size that needed to be able to build and predict the length of stay accurately or slightly accurate?
Excellent question. The thing about machine learning is it's exactly that. It's learning, which means the algorithm has to go through a certain phase to learn the behavior of the data before the predictions can become accurate. What worked to our advantage is we had previous data on behaviors, not necessarily COVID, but flu-like symptoms. So we leveraged some of that data to sort of enhance the speed with which the learning was taking place. Now, is that the most accurate way of doing it? Probably not. But when you're in a position where you either have no data whatsoever or take what's already there and then do some feature engineering around it to at least give you a little bit of baseline, we opted for that second option because we would rather have some form of indication rather than telling them you might want to wait another 3 or 4 weeks until we have enough data to be able to do something, right? So that was one step that we had taken. The other aspect was a lot of the information was being reported from multiple hospitals. So we were able to leverage a whole ecosystem rather than saying we're looking at a single hospital that's got 50 patients coming in. We're looking at 50,000 patients that have come in a few weeks. So that also helped us fine tune those models.
Yeah. I'm sure the numbers keep raising for COVID, and that give us a chance as a data analyst to have more data points to be utilized, and really brilliant way to utilizing the behavior for another viruses or diseases to be able to benchmark it or to relate it to the COVID-19. As you said, at the end, it's the patient gonna have a frequency of day to stay in the hospital, and that behavior could be related or correlated with other viruses.
Right.
Now with you, Jan, I know that you're working with multiple vector and industries, not necessarily related to healthcare. And I think that's what we would love to hear more, what other industries or other element outside the hospital that are using AI and technology into the response for the epidemic.
Yes, exactly. So I think the guys, what they did for the health, it's enough. So for me, what we did in Netways, we worked more on the horizontal part, on the businesses themselves. You know that when this pandemic happened, companies and government and associations, they just somehow stopped from coming to the office because they were scared, and there were some regulations about the time that they need to attend and so on. So we created something called virtual workspace. So the traditional way of saying that I'm going to work, and there is a border where you go across the door to do the attendance that you attended the office, and then when you go inside the office, this concept is not valid anymore. So you just have to say to the enterprise that you are already working. So it's just I'm working or I'm not working. And you have to know exactly what is the need and who has to attend the office, because sometimes you have some people, they need to attend the office. So the system will gonna recommend and who are the team that should attend today, and who are the team that will attend next week, and who are the team that will attend certain shifts that they have the passes, because you have to present a pass for you to attend, and there is a limit of the capacity. So you have to have 30%, 20% capacity in a government agency. So the system will gonna kind of dispatch. So if you want to go office, it will tell you, do not go to Olaya, just go to the diplomatic quarter. So the system will gonna guide you where to go. And whenever you attend the office and you reach there is a camera that will take the facial, that will make sure that you have your mask attached, that you will have to make sure that your temperature is well taken. And for people working virtually from their home, Ahmad, you are still with me?
I can hear you fine, John.
Oh, very good. Okay, excellent. Because things should stop. And for people working virtually, they just say, okay, I checked in now. And the system will take the location, your geographical location, where you are checking in, because of some kind of crisis management. And we, despite the thing that happened in the pandemic, the corona. Lately, since few days, we had a big blast in Beirut. And by having all the people attending, we knew their locations, and the system automatically contacted them, asking if everybody is still safe. And within a few minutes, we just knew that who are the people that are safe. And thank God that all our team were safe in Beirut. So the system is not only toward guiding and dispatching and knowing all the facial and making sure all the policies are well treated regarding the capacity and the number of people attending. It's more also toward having a kind of survey to make sure that everybody is safe and who is not safe. And the system was also used in some places where you have a kind of evacuation. So you know that during the pandemic, in some places, you have certain flights, specific flights that went from Dammam to Cairo. So you have to know who are the people coming from Egypt, the Egyptian, the sitting in a certain place near the airport. So that the system is also can gather those virtually and can gather them in one place in order to issue like an exit entry for them, making sure they are well safe. So this virtual workspace was kind of used by horizontal multiple association and enterprises toward having a larger workspace and making sure all the regulations of the company and of the country are well done and treated.
Great, great. I lost my connection, the internet. Apologies for that. So I heard mostly about the virtual office utilization to manage the employee coming in. As I remember in the beginning, when we start coming back to work here in Saudi, also we had 70% capacity to the office. With a small team we have in Equant, that was a challenge to manage the team, and who's the team that should come in this week and next week, and to coordinate between us internally, and still I think that is a challenge. So I'm sure that there would be a lot of utilization for this technology inside our works.
And also, Ahmad, I wanted to, because in the place that you were out, we have also the crisis management. So anytime that there is a crisis or an event that happened, I talked about the blast that happened in Beirut, where by having the virtual workspace, we knew who are the people sitting nearby or in the area of Beirut. And the system automatically contacted them, asking if they are okay, because we sent a message, a survey for the people sitting around, and we knew that everybody is okay. So this is also can be used like a crisis management toward getting some virtual teams sitting in certain places.
And the system automatically generated this alert that there is a crisis happening in this location?
No. For us, we knew that there is something happening in this area. And I gave another example regarding the flights, because sometimes you have specific flights coming from one city to other, and we need to know who is in this city, so we can ask if they want to evacuate or they want to go home. So this can be used. So the AI here is used horizontally for multiple companies to create their virtual workspace and to help their team to work remotely.
Jamil. Okay, so now I'll try more to zoom in out and looking at the global effort happening from all countries, starting with the World Health Organization, when they started encouraging countries to publish the statistics for COVID-19, the number of cases and number of deaths. And we have seen that it started by end of January by China, then another countries comes in, and this data is structured very well. They all have the same structure of the report. And as a researcher looking to help the country, the first thing I would do is looking at this data and trying to come up with any insight or analysis. Also, I have seen lots of use cases by other industries outside the healthcare trying to blend these data with their local data and try to come up with insights out of it. I want to know your opinion about these public data are available for the public coming from the countries. Do you find it helpful? What's additional data points or element you think if it was available to the research, it will help really in making decision? I will start with you, Taimur, on that.
Very good question, Ahmed. I mean, that data, whether it's the Worldometer or a few other sources that collated data from a couple of aggregators, have been immensely useful for the lack of better data, no doubt. And as Abdo mentioned earlier, some data is better than no data, right? So it's leveraging what you have will help you see the woods from the trees, basically. However, looking at it, it's still useful, but I think the key challenge dealing with that data today, last time I've looked at it was, I think, mid-June or early July, to be honest, is the lack of consistency from geography to geography on the accuracy of the data or the way the data is reported, right? So where you have some countries, we have very good examples here in the Middle East, where they have good tight control over testing and reporting, and there's basically reliable numbers that are being reported. You see some other regions from across the world, regardless of basically how developed they are or how bad they are, you see a lot of variety of some of the numbers not being realistic. I think the deaths and the death rates, the deaths has been, I think, the most accurate and reliable figure that's been reported to date. But when you look at the number of new cases, number of cases that have recovered, etc., it's really each country you need to look at differently, or to somehow segment or group those different countries based on how you see them being reported to basically help you predict what's going to happen next if one country is ahead of the curve for others. The other thing is capturing what intervention measures that the governments are putting in place has a huge effect on which way the numbers go, right? And this could vary from country to a city level to a neighborhood level, right? So when you look at the numbers coming from the US, and I think they've addressed that probably, all the states were reported on as one number. So it's a different story in each one of those states. And that applies also to other territories. So immensely useful, but no doubt has a lot of room for improvement, and no doubt it will improve if this situation is here for stay for an extended period of time.
What's the additional data point you recommend for this country to be published?
I think it's the city level, and I would basically probably recommend that if the numbers are not accurate and consistent with the methodology, for it not to be reported is better sometimes, because it can be misleading. But I know the challenges of reporting and capturing the numbers, specifically when the outbreak happens and numbers grow exponentially. Government agencies and authorities are more concerned about delivering healthcare for the people who need it than reporting numbers, right? Understandably. So I think it's getting more accuracy and maybe more granularity to have it on a city level. And there's a lot happening in the whether it's contribution, open source, and people helping out, that I'm sure we'll be able to blend a lot of data sources together to enrich that data.
Great. As we noticed or seen in the beginning of the crisis, some countries started with the country level, then they went to region or city. Here in Saudi also, we started as on a country reporting level, and then we went down to region and province, which is a city as our terminology here in Saudi Arabia. And that is available in COVID-19.omh.org on daily updates. I think every 8 hours now they started to update this number in dashboard, but within a 24-hour, there is a documented report coming from Ministry of Health for the total number. As you said, we need to look at more in enhancing the accuracy of the numbers and trying to drill down more to the level of geography on city. Great.
And I think number of tests has been quite a valuable figure that started
Yes.
being reported consistently from across the globe. But I think another one which I would look forward to see that is how's that number of tests broken down by targeted versus random, and the outcome of each one of them would allow you to actually get a feel of what the overall situation is and how good is a certain country in targeting high-risk areas or high-risk individuals.
Yeah. Yeah, for that mostly World Health Organization saying that positive case ratio should be around 10%. So if the country getting 10% positive cases out of the total tests, patient data, that is the optimal number they should be around. However, from the aggregated number as a test patient, you cannot know if that is a targeted patient or he had a contact and that's why he was tested. Also, mentioning in the structure of sharing the data, as we've seen maybe in China, maybe in the beginning of the pandemic, in mid of Feb, they changed their way of reporting the data. That's why we see a fluctuation in their number. And also, listening to the actuaries from where I come in UK, as an actuary, we care mostly about trying to predict what is the mortality rate from any diseases, where the methodology in UK in the beginning, we're seeing a high number of deaths, and the actuary is trying to predict that by looking at the historical mortality rate and seeing the excess of death. Then the actuaries respond to the country that, the number of deaths is higher than what we are in the actual. So some countries, they're reporting less, but UK, they are reporting higher. I think their methodology that anyone who getting COVID, even if he died by an accident, a car accident, he would be reported death as a COVID. Here in Saudi Arabia, we look at the morphology code for ICD-10. If it's related to the COVID-19, it would be reported as a COVID death.
Right now, I think you bring up a valid point. So the concerns about the numbers go in two directions. It's about depth and breadth. So with depth, about geographic depth. So if we were to talk about the states right now, we've gone from country to state, from state to county, from county to zip code. So we can get those numbers at a zip code level to understand how many cases are happening within the zip code. So that's from a depth perspective. In Canada, it's quite similar. So the reporting is being done at a city level. So we can talk about what's happening in Ontario, but we can also talk about Ottawa specifically. We can talk about Toronto specifically. So that's from a depth perspective. The other challenge is the breadth perspective. And that's when we want to start talking about severity and then mortality rates. Because if we were to just look at the data that's being reported on right now, there isn't a whole lot to go off of if we're looking at it from a scientific perspective, because there are a lot of patients that are going in where their full demographic information is not there. We don't know what their clinical pathways look like. We don't know what their previous conditions look like. So previously, when this first started, we used to hear, we need to protect the elderly. We need to protect the elderly. And then later on, we started finding cases of people who were in their 20s, but had to be on a ventilator for about 4 weeks, right? And that was going against it, because the initial models that were built based on the common data that was shared globally. And it was the age demographic that was the most common element across the board from all countries. But as we start digging deeper and deeper, we realize that it's not just about the age of the individual. It's not just about the gender of the individual. In some cases, they started looking at blood types. In some cases, they started looking at lifestyle and how athletic they were. So, and in some cases, some individuals had pre-existing conditions. So that also has an impact on the data. And I think the challenge we have right now is to normalize one standard that would put all those factors in there because of the different challenges across the geographies that we have. The third element, which is quite difficult to capture, and that's when we start talking about unstructured data, is about specific socioeconomic events that are taking place. So a famine, riot, all those events that are taking place, which you cannot necessarily put in a specific structured field in the data. So you'll notice that there are a lot of states in the US where riots were taking place. 2 weeks after that, the number of cases significantly increased. We saw something similar if we go back to Lebanon from last month. The numbers were in the 30s per day being reported. This week, we're up to 290 being reported on a daily basis for the last 5 days or so. And that's because of all those interactions. And it goes back to the conversation about contact tracing. But that is not a feature, so to speak, in the model that we can easily add for all the countries, because not everybody has access to that data or is publicly sharing that.
Okay. And Jan, do you have any comment on the same topic?
What I'm sure about that, at least till now, AI was not successful in predicting or in terms of analyzing the data provided. But what was mentioned is accurate. If you combine this data with maybe other information like weather, for me, I'm not in the medical area, but what I know that there might be some factors that can impact the thing in terms of probability of impacting or the death ratio in terms of population. There are some factors, I guess, or this is what I'm seeing, it's not yet discovered. So AI and big data is important to combine the data that is provided by hospitals along with some socio-economic or geographical or the weather related or the humidity maybe. So I'm sure that they will discover at one stage, because big data is a big thing, that you can combine multiple factors, multiple dimensions, multiple things. Sometimes they are not structured, even they are not related. And maybe a model by someone inventing something somewhere, he might be able to discover the secret behind this pandemic here.
Great. Let's hope the data availability will increase. I didn't expect to see something similar to what's happening right now of sharing this data on daily basis by all countries. There's something good as a beginning, and we wish that we'll see more and more data to be public in the future.
Sure, this collaboration that is happening by all countries is something that didn't happen before. So all the world is just mobilized to provide whatever data is there, and they are communicating. And I think this is very useful. Maybe till now we did not get something useful out of it, but some information such as the probability and the numbers and how it's increasing. And let's hope that this will help at one stage for the future to help the medicine in this part.
Great. Now I would like to ask you more about the adaptation for these AI use cases. How you find the implementation phase within the healthcare facilities or even governmental or private sector, how they were able to adapt with this new AI technology. And definitely it required a lot of enhancement or changing of their infrastructure to be able to run this AI model at a scale. And they were ready for that or not? Abdu, you talked that you already implemented something for the healthcare hospital.
Sure.
So how was that challenges?
So let's look at it at a few lenses. The major advantage that we have right now is with the power of cloud computing. In the sense, previously, a few years back, when we wanted to do something like this, you have to go out, buy the equipment, and do that capital investment. Today, we spin up a server farm in about 15, 20 minutes. It's up and running. We use it for whatever we need to as an experiment, and then we can wind it down. That was a major advantage for us in having a very fast response time to this, where we didn't have to go through the process of let's get approval for a massive budget before this gets going. The other thing is people were very open, even though previously there were concerns about using technology for this type of work. People didn't believe that it could actually help and give the results, because sometimes when you tell people you're talking about these predictions, they look at you like, what kind of weird stuff are you talking about? So we started out with proof of concept, smaller cases to make sure that people are on board. And the key was to be able to educate them on the process that we're going through so that it made it more real. The other thing that we always talked about is people talk about AI as being artificial intelligence. We kept insisting that specifically when you're talking in the medical field, we talk about it as assistive intelligence. In the sense, the decision at the end of the day is left to the human to make. It's not fully autonomous. The solution will give you a recommendation. It'll give you advice. It'll point you in a general direction, but it's up to the doctor or the nurse at the time to take whatever course of action is necessary or to make the call. And it was important that we relayed that message that there are no decisions that will be made without the doctors. It's just there for assistance. So I think those were the key things that we had faced in that environment.
And the adaptation for the healthcare worker to utilize this technology in their decision-making process.
It was quite interesting because previously, so if I talk about us doing this maybe a year ago, there was so much resistance where people would just think of every possible scenario to say why this would not work. And right now it was quite the contrary. People were looking forward to what was going to be coming out. And rather than you having to battle to tell them, let's try this out, they were encouraging you to try it out. And moreover, they were pushing to make sure that the results and the performance of the model that you had, they need to be better because they could understand how this was benefiting the patient that's on the floor. So that for us was quite an interesting change in going from, on one side they were resisting it a little bit more than a year ago to now they're actually looking at it as supportive technology.
Amazing. It's really music to my ear to hear that. And we hope to see this adaptation of this technology across industries without a crisis. And we don't need a crisis to force us to use or to at least look or give the opportunity to this technology to support us in our decision making. Definitely, as a human, we have a capacity of way of thinking, and definitely AI are smarter and more intelligent than us. So using it as a assistant in our decision making definitely is an advantage. Timur, also the mic for yours.
It's very interesting to hear Abdul's perspective on this. Like people, I've noticed that as well now. Abdul mentioned it, got me thinking about what could be the drivers for this. Yes, people are more perceptive to see how technology can help them, and so worked closely with a lot of decision makers, whether that's big organizations or influential policy and decision makers. And one thing that is consistent that I've heard many of them say is they're having to make decision in a split of a second, and the amount of information flowing in and the amount of decisions they're making in the day being 12 and 14 hours during the early days of the night is unprecedented. So I think part of that is not being able to deal with the situation, the severity of it, get people to think about what can help, right? الحاجة الاختراع, necessity is the mother of all inventions. So I think it's probably a key factor why we've seen this step change in willingness to adopt technology and AI to enhance decision-making process.
Great. And for you, Jan, in terms of the adaptation, also from other businesses outside the healthcare facilities. As you said, the best advantage for COVID that it enforces to go for digitalization path. So that definitely increased the size of data availability for us as a researcher, and also adapting the technology within our day-to-day operation.
Yes, I see this is a rational change because it's not only a by choice. So it was like an obligation. So you have regulations, you have people cannot go, so they have to go and shop online. People cannot go to government agencies and they want to issue some kind of papers and they want to deliver something in the previous places. You call on the phone, someone will call you, will tell you come, they give you a meeting. Even in some places like embassies, they now giving a time slot for people to come because they can be channeled. So no more you go on the crowd and just wait for your turn to go to the counter. So it's a complete change in the culture. And even working from home now, it's giving us more time to sit with the family. So it's a better, like people, it's more appealing. And I think that even after this pandemic will go, the business will not be the same. So it's an adoption that happened by between bracket force. So it was not a choice. And I don't think it will go back to normal after this pandemic will go. So things will not be the same in the coming years.
Definitely. Okay, so let's try now to move toward more future perspective. I've been asked before the session to ask you guys, did AI predicted the epidemic for COVID-19? And will it be able to predict a new pandemic? And what we could do from now trying to predict these? Abdo?
Sure. So the big question becomes, at what point do we consider this a prediction? So at what point in time? Because there's a case study out there about a company that does the social media sifting and the medical reports that says that all the way back to early December is when they identified that the pandemic is coming because of the way that the medical reports were being written. They noticed a trend in specific cases in China that were being reported way before it even made it on the news. And they went as far as tracing people's travel logs and their airline bookings to see how that spread. So their claim to fame is back in mid-December, they had already seen this and they had flagged it. So would we look at that to identify that as a prediction? Probably. The next question that would be interesting is, well, if we managed to get that right for this one, how many times were we wrong? Right? So how many other incidents did we potentially identify that did not materialize? And that's the challenge with these cases, right? Looking at the false positives and the true negatives to try to see whether we're talking about a small experiment or if we're talking about something as large as being able to predict a pandemic of this size. I think where we're at right now is we have enough data and we have enough tools in our hand to be able to understand what the spread would look like. Yes, I think we have that. There's enough models out there to say if people are willing to quote unquote give up their data, then we can definitely be able to understand. And without getting into a discussion on policy or social distancing or any of that, so regardless of where you are on the fence with that, you can say we want to go with herd immunity. We have enough data to say from a model perspective, well, this is what's going to happen. Or if you say we're going to keep on, complete lockdown, we can look at it and see where it's. So I think we've gotten to a point where we have enough data to do the what ifs and the simulations.
Okay. And what we could do from now, trying to prepare any additional data sources or preparing some AI model to be able to predict future pandemic?
So to talk about I think to be able to predict the future, it's not just about predicting, it's about early detection. That's going to be the key, right? It's to be able to identify it and pick it up very early on and learn from whatever we're going through right now. But it depends if the next pandemic is going to have similar behavior from a data perspective, not just from a social perspective, from a data perspective, if it's going to have the same behavior or not. We've managed to leverage some of the stuff that happened previously to help us with this. So hopefully we'll be able to leverage some of what's going on now to help us with what might come up in the future.
Great. Timur, what's your take on this?
No, I see. I mean, it is unprecedented pandemic and unprecedented circumstances we're going through. I find it difficult to predict, to comprehend that a model would have predicted something it hasn't seen before, right? But as Abdul said, I mean, early detection is going to be better going forward if we leverage what we've learned from this. Something we hear more often now is also the frequency and recency of the data and the data sources. So moving away from the medical space, for example, on the monitoring economy and economic impact on different sectors, the lockdowns and the social distancing and the change in behavior is taking effect. You see a lot of the policy and decision makers looking at high frequency data points rather than waiting 3 months for a quarterly report that say, here's the GDP and contribution by sector affected. Today, you hear discussions about looking at on daily basis from footfall data to credit card and debit card transactions, liquidity measures from financial services sector. I'm sure numbers and aggregate numbers from medical facilities. All these things are going to help predict things better at a more on the early detection phase. Also on the predictions as well. I mean, the aftermath of the COVID is now a big concern as well. It's basically how the different sectors is going to be affected. People might losing jobs for a lot of people and a lot of segments of our communities is a bigger concern than catching the virus today. And when you hear, is there going to be a new lockdown? People are more concerned about. I mean, I hear people asking that question without wearing masks, and so like, you don't look so concerned. Well, I'm not so concerned about catching the virus. I'm concerned about losing my job or losing my business. So there's so much now that's being monitored at a closer frequency, at a more higher frequency today. And AI has lots of applications for early intervention that can reduce the impact, reduce the cost of intervention as well, if leveraged properly.
Jamil?
Yes.
Ahmed. Yes, Jan.
From my side, I see that sensors and all the places where the data is being captured are increasing enormously. So each office now has a temperature that will, the machine to take the temperatures. You have the cameras to take the facial expressions. You have the wearables, and we're gonna see all the mobile applications and all the devices that will have lots of things to take the information, the human, the personal, not personal, but maybe the condition about the people. Their distance from others, their place, location, and so on. And I think by having all this kind of spread and hundreds and millions and hundreds of millions of data, I think the AI will be able to predict if things will happen somewhere, and all the symptoms will be captured, because this will not, it's not the first pandemic that happens over the history, and it will not be the last. So all the time viruses are being evolving, and they are becoming more strong toward attacking human. So the only thing that we're gonna see in the next generation of mobile, in the next generation of watches and devices, in the next generation of companies, the way that they will be distributed, we're gonna see more and more devices to capture information, and this information, if it's gathered in one place, they will be able to generate the huge and valuable information for future fighting this kind of virus.
جميل. يعني you're saying that our preparation of adapting a drone or IoT sensor in our day-to-day life, that will help us definitely with this epidemic and the new epidemic.
Sure.
That's one question that we received.
100% ready. Maybe now we are not ready, but I think the next generation will be stronger and more smart.
Yes. I seen a report that drone delivery wasn't a thing prior of COVID-19. Now I see a couple of startups here in Saudi Arabia focusing only on drone delivery, which is a great technology that we have previously, but no one looked at it for this type of services yet. Definitely COVID changed our mindset. Me personally, I learned a lot from COVID during this pandemic. New way to work, new ways to look at and problem and perspective. And I'm sure each one of us have their own story of how we learn from COVID-19. I would like to hear from Abdu on looking at COVID-19 data and playing around with this analysis. I received lots of questions of what is the most model being used to trying either to predict, to analyze, or as a machine learning model that is suitable and user-friendly with healthcare patient data.
Okay, good question. I'm glad that came up, and because I think this is something that we haven't talked about before we get into the technicalities of it, of which model. One of the fundamental aspects when we start doing these projects is being able to define what the business question is. And I think that's something that a lot of clients, when they start working on AI projects, they sort of forego that step. The assumption is when we put an AI solution in there, it's going to be able to answer anything and everything, but that's not necessarily the case, because today, when you build a model, it says, is Abdu going to contract COVID-19? Yes, no, as a classification model versus what is the likelihood of Abdu contracting it? Those are two very different questions, mathematically and from a model building, from a data preparation perspective. And a lot of people take that for granted because they think, well, in both cases, I'm just trying to figure out if the person's going to get it or not. Well, but from a machine learning perspective, those are different. One is a classification exercise, the other is a regression exercise. The way we prep the data is different, and the models that we use are quite different. So I think it's important to first try to understand what's the business question that's being answered, what are we trying to get to? And then from there, before we even start building the model, to think, when we get the answer, what are we going to do with it, right? So if we were to say somebody is a yes or a no, or somebody has a 76% chance getting it, how are you going to deal with those differently from a business point of view? So from either being from a hospital perspective. So today, if we were to tell a hospital, going back to the exercise of the length of stay, if we were to tell the hospital that this patient is going to be a 3-day patient or a 3.5-day patient or a 3 days and 2.5 hour patient, how are they treating it differently? At the end of the day, the patient's coming in, the best that we could do is to go down to a resolution of half a day, because at the end of the day, they have to get it out, they have to get the rooms clean, they have to get the beds cleaned and swapped out. So there was no point in going into something that has a lower resolution than half a day increment. So I think before we get into the algorithms, we have to focus on the business question, identify what type of problem that we have. And then from there, we can start talking about which algorithms are out there. There are a few cheat sheets that are made public. It's neat. I think Microsoft has one that's pretty cool that says, depending on the type of problem that you have and how much data you have, you might want to start here. And we always talk about those algorithms as being a starting point. Going back to the power of computing that we have right now, the nice thing that we have is we can run multiple algorithms simultaneously. So we'll do the data preparation and then we run multiples and then we let them benchmark to each other. And On one of the latest projects that we've done, actually it wasn't in the healthcare sector, it was fraud detection with the government. We noticed that one algorithm was biased in one direction and another algorithm was biased in the other direction. We actually used both of them jointly to sort of offset the bias. And the results that we managed to get by using those two was quite amazing because you leveraged the best of both worlds. And it was the first time, to be honest with you, it was the first time that we had done that. We were sort of stuck in a place where one was doing really well here, the other was doing really well here. And the question was, which one do we go with? And the answer was, let's go with both. And how do we design the experiment in a way so that when we get to that point, we identify where the bias is, we shift it in one way or the other.
Amazing example. And I see COVID challenging us, and we're trying to combine our intelligence and science to overcome these challenges. And brilliant solution by combining these two model and coming up with a final prediction. But the question that I received, they want a specific name of an algorithm. I told them, like, for classification, there is a lots of popular model that everyone used, but they want to hear from someone that already used that specific model for specific use case. So if you can give us one name of a model that you use for a prediction, for example, for long stay.
So in one of the cases that we had used, we leveraged neural nets very, very heavily. And then there was, I'm trying to remember what the other exercise. Naive Bayes was beneficial in some of the cases. In the early cases where the data wasn't too massive, but then we had to shift as the data was growing. The performance of the model wasn't super great, but it gave us an indication as to what features we needed to create. So it was a good starting point, but then with time we had to try some others to sort of move in a different direction.
Yeah, I'm sure it will show the importance of the feature right away, and you could utilize this information on other models, so on. Great. Timur, you would like to share anything here on the same question around the model that utilize on trying to predict the epidemic, or any prediction that you use in your services? Yeah, you're muted, Timur.
I'm going to avoid the embarrassment and not go to that level of detail.
Okay.
There's been a lot of trial and error and trying different things. And what Abdo mentioned about the use of variable methods, almost brute force, try everything out there and benchmark them against each other, is something that we do more often today than I expected. And yeah, I think it depends on the nature of the problem, but this assisted modeling, if the term uses right, is something that we're using more often. Making some of the knowledge and experience gained over the years less and less useful, I guess.
Yes.
But it's making a big difference in how quickly we can spin things out.
Yes, definitely. And yeah, when I see this assistant model and AutoML, I'm really scared about my career. And it's like, okay, who gonna create the AI now is already automated? Yeah, we are at risk. Brilliant.
Who thought that's going to be the case, right?
Yes. And so I think now we're done with the question from my side. I will open the floor for the question from the attendees. We have a question about the utilization of AI and drone directly as a use case on the COVID-19. I think, Jan, you would be the best to answer this. You're also muted.
Bas, what was the question?
The question was about using the intelligent technology like a drone the advantage of COVID-19 era? So specifically, yeah, drone utilization on COVID.
Yeah, in all what's regarding AI, you have three category of decisions. First, you have all the senses. So you have all the visual senses. So you can count the number of people in a certain area. So drones, once if they are going over a space, they can count how many people are sitting in some kind of square meter. So they can see if they are safe or not. So you have the visual, because drones, they can do visual. They can take photos about different places. So they can report back if there is any issue. Second, they can smell. They can smell the temperature. They can smell the quality of air. They can do any kind of listening. Also, they can see some people maybe asking for help or something like that. So drones normally, when they go, they have all the kind of senses, and they are just flying, and they can, even if it's night, they can even see if there is any unusual things. They can report back to the police department, to companies, to events like marriage, like any kind of crowd. And an accident, they can be the first people to reach the accident, and they can just see what's going on, and they can report back. And all the treatment about those data will gonna predict, or will gonna report a problem or something that will happen.
Great. Another question for you, Jan. On the app that you implemented, I think they're referring to office management. How did you solve the privacy issue for the data?
Good question. Our app is mainly targeted to business to employees, so they are employees. So the company policy will gonna categorize the employees toward who has the optional thing to report back his information, such as the geographical location. So some people do not need to report back. If they want, they can. If they don't, they can report back without activating their GPS. But you have different levels. So you have the green level, where it's a work as usual. And then you have the other levels. So when it reached higher level, no need for any kind of information. And even companies will not oblige people to work from a certain place. So they can report or do not report. Any kind of information is good. If they say we are still alive, it's fine. When the application alert will be at red. And if it's work as usual, maybe they will just put obligation that you need to be attending the office. You cannot attend from home. So they put the company policy toward different levels of urgency or alerts, or the category of people. So the combination between a group of people and a group of the situation that is at this moment in a certain place.
Right. Okay, I have the last question from Mehdi. What are the most profitable AI use cases that emerge as a result of COVID-19? I will open this question for all of you.
What is the most profitable?
Yeah, profitable AI use case that emerge as a result of COVID-19.
It depends. You have some time, because you have lots of competition. So lots of companies, lots of startups, they are going with lots of ideas. So it depends that at the end you have one idea that will live. And sometimes you can think about something that nobody thought about, and you will be a winner. It will be the most idea. And for me, the most profitable one is the one that nobody thought about yet.
Yeah. Then let me change the question to the most successful, not profitable.
Yeah.
Yes.
I think there are a couple out there that we can talk about. One is just down the street from me here in Toronto. If we want to put it in the context of profitability, today organizations being able to resume the normalcy of their work would to me would be a profitable thing. So one of the startups here in Toronto built a robot that had the UV lights on it that would automatically navigate within the building and sanitize with light, sanitize the space. The AI aspect of it is it was able to navigate autonomously, which was impressive. And then accordingly, it would identify high-risk items. So the buttons on the elevators are a high-risk item where, there's a lot of contact that was happening on them. And it would allocate more time on the sanitization of those than it would just walking through the rest of the floor. So that to me is an interesting use case that has been deployed. It's successful. It's working. And the people in that office have managed to make it, back to their offices a little bit faster. So I don't know if you'd want to put that under the premise of profitability or not. Yeah. Another use case we're working on, this is actually an active project right now, is one of the big challenges in the US is universities going back into session. So having students to come back to campus. And one of the biggest challenges is how do they deal with that? What happens? How can they monitor when you're a campus of several thousand students? And so by using IoT, and to be honest with you, some of the algorithms are out there to pick up, just small cameras on a Raspberry Pi that costs no more than $40-50. You can put them in the hallways, and it can measure the spacing between the individuals in the hallway just to make sure that they're actually maintaining 2 meters apart. So that was one. And the other one was thermal cameras that would allow you to measure the body temperature of individuals as they're walking. So you didn't have to stop them, take the measurement. And then, because most of the time when people were taking measurements, it wasn't being logged anywhere. So they would just stop you. They would take the measurement here, and then you would proceed. With these two different solutions, the nice thing about it is you actually get to keep a record. So you can see how things are evolving over time, and if people are sitting within close proximity, and if they have a high temperature or not.
Great.
Yeah, for me, Ahmad, I shared a link that is useful for something called AI Venture Labs. It's a place where you have 100 startups. It's 100 ideas about how to fight COVID-19. They are divided into 9 tracks. So you have 9 different tracks about how you do it. And you have the names and the ideas about those companies and those startups around the world. So it's an article. It's a very useful article. I think everybody that can check, maybe you can publish it with this one. You can find it's a nice article. So it has all the ideas regarding those, what are the different places from capturing, from crisis management, from medicine and the prediction and all everything is written inside.
Great. Example for AI use cases. I went through these the LinkedIn page for AI lab, and I have seen some documentation for the ideas. Some of them quite understanding, really.
And it is in both languages, in Arabic and in English.
Yes, if you could share this in the chat, so all the attendees could have the link for it.
Sure, I'll do it.
Jamil. Timur, any profitable AI use case you were across to?
It is a good question and a tough question as well. I think thinking about profitable and successful can be different measure, but from what I've seen as reports and white papers published about the change in consumer behavior that's been introduced by this pandemic, a lot of businesses relied heavily on AI for a long time, and pre-existing well-trained model and basically pre-existing customer segmentation overnight suddenly became not so relevant. And I think those organizations that were able to adapt and were agile enough to readjust their business, readjust their focus, have benefited financially and from growth perspective out of this pandemic, because we've seen supply chain disrupted in many different areas, right, and across the globe, and basically some companies been able to spot the trends, whether it's using human intelligence or AI or augmented or assisted intelligence. But I think a lot of the retraining of the models and rethinking about the problems that are existing and rethinking about customer segmentation. We used to think about it as basically income being key elements, geographical, demographics, age, gender. Now there's a people appetite to risk and their movements and their willingness to travel, etc. That puts people in different categories. Those are very risk averse versus those that are willing to take risks. And I think that's changing landscape. And I'm sure a lot of success stories going to evolve out of this as the dust settles now. But I think it's that agility is something that organizations will have to rethink about when it gets to that point in terms of on priorities.
Yeah, personal appetite. You can see it now. A risk appetite. Of someone wearing mask or not. I think that could apply very simple here in Saudi. We will see some people who's careless, not wearing mask or taking precaution, also have a correlated with their risk appetite on taking more risk.
And in some countries where more leaning towards the herd immunity element, so where they haven't introduced strict lockdown measures, where some people are forced to be very risk averse because they are quite close proximity to more vulnerable old people with pre-existing conditions. They living a different lifestyle from someone who's young and healthy and going on with his life as normal as he can. It's rapidly changing, and I'm sure we're going to see a lot of about some success stories, and some would stay hidden maybe.
Yes. Also, I have a question from Khulud. How can countries keep the lights on the COVID-19 pandemic and beyond through emerging robust technology like AI? So mainly, on a country level, how is the utilization should be or could be from AI perspective and advanced technology toward trying to save life?
I think one is keeping the lights on, meaning keeping life as normal as possible and avoiding situation where it gets to a crisis post the healthcare crisis, which is given now. I think one thing we're working on is looking at helping one of the governments in the region here is look at food security and strategic food reserves. Right, it's a key element. Supply chains are disrupted. We've seen some countries introducing export bans to make sure that the existing key commodities are enough to serve the local demand before they can export. This affects a lot of other countries who 100% rely on imported goods. So there's elements of predicting a supply chain disruption or early detection of supply chain disruption, but also being more accurate about the forecast of the available quantities, how long it's gonna be enough for, if basically the lead times for ordering and shipping and delivering certain goods, how likely that's gonna change based on what we've seen and what's changing. So it's one of those areas that AI and data analytics is heavily used to avoid crisis situation and keep the lights on in certain territories.
Yes, and sometimes I always say that thanks God that this epidemic happened in 2020. If it happened 2 years prior, would be much worse, because either the technology and the resources that we have from cloud computing, from AI availability, it wasn't that ready. Our response now is much faster and much advanced because we have this enabler from cloud resources and from open AI codes that are available for everyone to try to use and testing on them. So some bad and positive stuff happening here, but thanks God that we as a human reach that advantage. And let's hope that any next epidemic will happen that we are ready and prepared for. That's it, from my side. We cover most of the question. Thank you all for your amazing insights and information, and thank you for your time. And thanks for the Ministry of Communication and Information Technology for hosting us and sponsoring this event. And finally, thanks for ThinkTech team for coordinating for this event.
Thank you very much.
Thank you, Ahmed. Thank you, everyone.
Take care.
All those attended.
Take care. يعطيكم العافية جميعا. شكرا لكم.
Thank you.
Bye.